Yeah, my name's Warren Dunkley. I'm an occupational therapist working for Oxy's NHS Trust. In 2014, I brought my pads into a ward I was working on and started working individually with a client. And from there, I got talking to our consultant, or junior doctor at the time, who's now your consultant on this ward, and we started to put together a non-contact boxing program, which today is Off the Ropes.
My name is Jess and I'm an occupational therapist working on Tony Hillis unit. So it came about with our consultant, who's quite involved with the charity, sort of discussions about how we could put it on the ward. So obviously we had to do a lot of sort of risk assessment and thinking about things like that before, but we came up with a really nice idea of non-contact boxercise and boxing.
Boxing for me, it's been a big part of my life. I've boxed for many, many years, professionally, amateur boxer as well.
It gives the guys a real sense of kind of being part of something. It's a kind of this boxing community. It's not clinical. When the boxers come, they kind of know, they know them really well, but it's not to do with their health or their care. It's to do with something they want to do and they enjoy.
Since a young age, I've done martial arts, and I did judo, capoeira, Muay Thai, and Jiu-Jitsu, Brazilian Jiu-Jitsu. And once I got in the ward, I saw the opportunity to start going back to like I would say my roots, like days like doing martial arts and things like that. And like the coach, like they're amazing. They just like, I just came to them, they were like, oh, you want to train, you know, what do you want to learn and things like that. So like I felt like I was home with them, you know.
The program's been going for about 6 months now, regularly every Friday, which is really nice. So all the clients know when it's Friday, it's time for boxing. And I think it's been on PQ for maybe a little bit less time, maybe 3 or 4 months. And then the acute wards, it's been for about 2 months. Boxing was coming up a lot for clients that they wanted to be able to do boxing. So we kind of developed the session kind of in conjunction with Off the Ropes for the ward. It went really well. The clients in the ward really enjoyed it, and it sort of built on from there to moving it on to other wards.
I like the thrill of it, and I like the excitement of the thrill and what it can give you, the feeling of just when you're punching, to know exactly how to punch and throw a jab, and whether it's a jab or an uppercut or a right hook or left hook. I like it. When I do a session, 30 minutes, 20 minutes, or if I can improve it to 40, 50, 60 minutes, it would be good.
So any physical activity that can be introduced in the ward is a benefit. For boxing, it ticks so many boxes. It's not just the physical part of it, it's the concentration, it's the pattern that you follow, it's the relationship you have with your coach. A lot of boxing is one-to-one coaching on the pads. You get to, you know, really interact with your coach.
Some of them are a lot more confident now. They've started going to the gyms in the community, which they weren't confident or comfortable with doing before because of what the boxing has built for them. And also it's a really good kind of something for them to do when they're discharged as well. So the boxers will link them in with local community gyms, which is really positive in terms of, you know, we want them to have lives outside the wards and see things for themselves in the future in the community.
It brings a good motivation because you take it in and you take what you've done in. So it's like inside and outside perspective. And it brings joy. When you know you've done something good for yourself, or the feeling of what you've done good for yourself, whether it's working in a shop making a lot of money, or even playing PlayStation, scoring 7 goals against Man City, whether it's amateur, professional, or semi-pro, it's good.
Well, I used to do boxing when I was younger, about 9 years old. Well, it's a good sport to keep healthy, you know, keep yourself trained in self-defense. Good, energetic, lively, after a little bit tired, you know, takes a bit of energy. They help a lot, they're therapeutic, they do.
Boxing is not just an sport, like an exercise and sport. It's just like it's like arts, martial arts. You know what I mean? Like it's like art. So like you just explore your feelings and all that. But for the physical health, it's like it's amazing because like you really like if you give all in or even like a little bit more, like the sensation that your body like when you feel like everything hurts and things like that, you feel like alive. You know what I mean? So like something like that. Watch some videos of people like Tyson, Muhammad Ali, and see how they doing the boxing. Like just study them for a little while, and if you think that's for you, go for it. And if you don't think that's for you, try it first. Then you're gonna have the answer. So like you should just give it a try, you know.
Boxing is therapy because I know the benefits of boxing for both physical health and mental health. Being an ex-amateur boxer for many years and a professional boxer. I struggled myself when my career came to an end. You know, the routine and structure that boxing gives, and the sense of achievement, and just the real kind of overall feeling of well-being when you're engaged in one of the sessions.
I think in terms of projects like this, they're so flexible that they'll be willing to travel to, you know, Ladywell unit, Douglas Bennett House, and that's what's so great about them, because often we don't have the facilities in acute and inpatient services. So when charities like Off the Ropes can come in and provide, you know, really useful and good sessions, yeah, it's great. So hopefully it will continue.
If you want to learn more about Off the Ropes, go to our website. It's www.offtheropes.org.uk. Check us out.